Hello, this is MINJUN, and I will present a case study of models and frames of reference. Our client is a 35 years old male diagnosed with incomplete paraplegia with SCI. His main problems are decreased lower extremity strength and sensation, reduced endurance. First, according to OTPF4 model, he has strong upper extremity strength, high cognitive ability, and motivations. However, he faces challenges with lower extremity strength and sensation. He can use his upper limbs effectively for wheelchair mobility and transfers. He uses some adaptive strategies for his lower body self-care. He resides in a rehabilitation hospital facility now and participates in therapy sessions consistently. He is from China and his facility is caregiving him now. The PEOP model is a top-down and client-centered approach. Unlike the OTPF model, the occupational performance is the ultimate goal for intervention and influenced by the person, environment factors, and occupation. PEOP process consists of four phases. First, in narrative phase, through client interview, we can understand the client life story, values, and experience. We can set a client-centered direction for therapy. Second, during assessment and evaluation, we can identify strengths and barriers of client. Third, in intervention phase, we can develop individualized intervention plans based on the assessment results and the client narratives. And the last, in outcome phase, we evaluate the effectiveness of interventions and changes in occupational performance. Then we can check our intervention was appropriate and adjust intervention plans if necessary. The PEOP model focuses on the interaction between the narratives, occupations, person factors, environment factors, and occupational performance. Through the narratives, we can get subjective data about client. And considering a person, environment, and occupation, we can decide the occupational performance which is meaningful to the client. If we apply to the SSCI patient through the interview, we can get his background information. Through the interview, we could know that he comes from a Chinese cultural background, motivated with treatment, and he has a history of living his life independently. There are main occupations such as house management, independent activities of daily living, and conducting family and social roles. Personal factors include a strong upper body, good cognitive skills, the need for catheterization, and limitations in the lower extremities. In environment factors, there are living in a rehabilitation hospital, using assist devices, and receiving support from family members. As a result of the interaction among these factors, his occupational performance demonstrates strengths in health management and challenges in lower body ADLs. Biomechanical FOR focuses on improving or restoring physical functions such as muscle strength, endurance, posture control, activity adaptation, and other things. Through improving physical functions and the client enables successful participation in meaningful occupations. So I focused on improving his physical functions by improving his muscle strength and training. He can increase endurance for ADLs and social participation and promote independent mobility and self-care. And the other concept of FOR is sensory motor sensory motor FOR. Sensory motor frame is based on sensory integration theory. The brain's ability organizes sensory information received from the body and environment and produces an adaptive response. In sensory motor frame, the main goal is improving participation in daily occupations by integrating sensory motor functions. So I applied the frame for the patient in the proprioceptive input way. He can improve the upper body and trunk body awareness. In the posture control way, he can maintain balance and stability better. In the motor planning way, he can develop coordination and control better. In the tactile input way, he can enhance motor planning and execution during ADLs. In conclusion, integrating the PEOP model with biomechanical and sensor motor FORs supports the client's goal of independence and meaningful role participation. This is reference what I refer. Thank you.